Hey everyone, my name's Ashton Davis, and today I'm just making a little presentation on oral cancer risks, self-screening for oral cancer, and vaping insights for young people. It's kind of a broad breadth of topics here, but I think they're all really related. And then at the end, I'll give my perspective as a third-year dental student at UAB on how dentists interact with oral cancer, their role in spotting it, and what we can do about it. So let's begin. To start, here's just some basic facts about oral cancer. Took a look at the Oral Cancer Foundation's public website. Nearly 60,000 new people in the United States are diagnosed with oral cancer yearly, and that number worldwide is actually 400,000. Oral cancer kills over 12,000 people yearly, and as far as all head and neck cancers go, oral cancer comprises 85% of that. So that's including things found in the mouth, and then head and neck cancers. That also includes stuff found oral pharyngally, obviously excluding stuff found like in the brain and stuff like that. Death rates are extremely high for oral cancer, higher than you might think. We've listed some here, like Hodgkin's lymphoma, cancer of the testes, and whatnot. Other types of cancers that have higher death rates. Oral cancers among them if you don't catch them early. Moving on, so some of the demographics about oral cancer. Oral cancer is 2-3 times more likely to appear in men than women. According to the Oral Cancer Foundation, oral cancer is something that typically affects older populations, but it now, through research, has been found to affect younger demographics more than previously thought. Oral cancer is twice as prevalent in African American populations as compared to Caucasian populations. And something else that I found interesting that we'll kind of delve into later in this presentation is people who vape are younger than 35, mostly on average. So that's what we're going to be classifying as a young people in this presentation, people younger than 35. And later we might see, is there or isn't there a correlation between vaping and oral cancer? That's something that a lot of people are interested in nowadays. So I thought I'd take a look at some of the research. So what causes oral cancer? It's really well supported that we know that tobacco and alcohol are things that are heavily tied into development of oral cancer, which is to say it's very environmental. It's not something that you're genetically predisposed to in most cases. The risk of developing oral cancer is actually 3 times higher in smokers compared to non-smokers. And that risk of oral cancer after 4 years reduces back to your same risk if you were a non-smoker. So there's an incentive to stop smoking. We found alcohol acts as both a local and systemic risk factor. It actually increases the permeability in the lipids of the oral epithelium, these lipids can interfere with your DNA dogma, the DNA synthesis and repair. Additionally, we put a little note here. Research continues to develop since the advent of vaping, which will be addressed later in this presentation, like I said. Okay, so how does it look? The presentations of oral cancer. So the majority of oral cancer presents itself as squamous cell carcinoma, SCC. But also there are other potentially malignant disorders, which are maybe early stages of oral cancer, classified as leukoplakia and erythroplakia. Leukoplakia is usually a white lesion found in the mouth, whereas erythroplakia, a little more advanced, is a red lesion. Oral squamous cell carcinoma typically appears white and patchy, like I just said, but like I said, it can have an aggressive red presentation as well. If these lesions don't resolve on their own in a couple weeks to months, you can rule it as potentially a squamous cell carcinoma or a potentially malignant disorder, as opposed to something else like cheek biting or something of that nature. If left untreated, there's always a chance for metastasis to other locations in the body. These can go to the lungs, the cervical areas, those lymph nodes, the mediastinum, liver and bones and stuff like that. So this is why we want to catch these early. Where are some common places for oral cancer? There's kind of 3 main areas that you really want to be looking for. 3 main areas where It's likely to be oral cancer if you see a lesion in that area. That's the lateral border of the tongue. Another one is the floor of the mouth, and finally the lips. But there are other areas where it can appear as well. The roof of the mouth, the gingiva or the gums, and the palate. Why self-screen for oral cancer? So oral cancer in many cases becomes deadly once it's metastasized to other places in the body, like we mentioned before. Additionally, this is one of the main reasons why you might want to self-screen for it, is it's oftentimes painless and really difficult to notice initially. Not at a dentist office or something, you don't have a bunch of light, you don't have a really good eye on anything, so it's something that can progress without you even knowing about it. Catching a suspicious lesion in the oral cavity means it can be evaluated. So oftentimes if we see something in one of these locations that is a high-risk location, it can be biopsied, meaning sent off to a lab, discovered what it is so we know exactly. Oftentimes before or after a biopsy, you could excise what it is and get rid of it early before it's somewhere that isn't as easily excised as it is in the mouth. Okay, so my recommendations on oral cancer screening and self-screening specifically. So some of the first places you can look are actually outside of the mouth. I know that's kind of outside the breadth of what we're talking about here, but it's part of an order or something that I like to do as a dental student and something that you might be able to do just so you don't forget anything. So first, examining the skin, behind the ears, at the hairline, at the vermilion border of the lips. These are places where we get a lot of sun and a lot of UV radiation. You can also palpate, feel along the sternocleidomastoid muscle in the neck down to above the collarbone here. These are places where you have cervical lymph nodes. These places are prone to early metastasis. So if you feel something hard and fixed in that location, that might indicate something suspicious, something to be checked out. Now, getting to the mouth itself, you can palpate, like I said, or touch along the gums for any tender patches, looking again for any white patches. You can look now at the roof of the mouth, the floor of the mouth, and along the dorsum, so the top of the tongue, for anything suspicious. This next part is kind of hard to see the sides of your tongue or the lateral border of your tongue, so you could grab like a cotton 2x2 and actually pull your tongue forward and then look at left and right if you see anything along the lateral borders of the tongue, because that's one of the main suspicious locations. Finally, you can look in that oropharyngeal area, kind of where your uvula is, looking for any sort of patches or anything suspicious. Also, I mean, you can look at the cheeks and all those locations as well. So, all right, so this is kind of a little detour, but it is something that is extremely interesting, and I wanted to personally look into vaping. So we know vaping's become really popular in recent years, and we know cigarettes have a high correlation and causality even with oral cancer. So what does vaping contribute to that? Like I've written here, with the advent of e-cigarettes and vaping, people in the younger generations are using this as a form of nicotine delivery. Sometimes because it's addictive, sometimes because it's popular. But we found research as of now is extremely limited on vaping. You really want something reliable for something like this, and to be reliable, it's got to be done over a long span of time, and those sorts of studies have not been concluded yet. While we do know there's a lower level of toxins in e-cigarettes and vapes compared to the conventional cigarettes, it doesn't mean that there's not these toxins, so it does not preclude these alternative forms of smoking from actually having some sort of correlation with the oral cancer rates. So what I'm saying here, there's a chance that they may increase the risk of oral cancer, but we're not 100% sure. So what are my thoughts on this? Even a reduced level of carcinogens has the potential to cause cancer. If you're conflicted due to the lack of long-term studies, like I'm saying, you could always err on the side of caution when you're thinking about using these products. What's my main takeaway, though, is that more research is needed, but that doesn't necessarily mean that it's safe to vape as an alternative to smoking just because there is a reduced level of toxins. So just keep that in mind as these studies keep coming out. Okay. And like I said, I'm a dental student, so what are my final thoughts on a dentist's role? So as a dental student, I think the dentist plays a really important role in the early detection of these lesions because it's something while you might be able to self-screen. A dentist is really trained to look at some these things and figure out what they are, or at least get them biopsied so we can figure out what they are. Many times the dentist is the first person that might see something like this even sooner than the doctor. You could go to the doctor, any number of times before something gets so outrageous that it's noticeable, whereas a dentist might see it before it's even detectable by anyone else's eyes. So I think a dentist should make it their responsibility at the beginning of every comprehensive oral exam that you do on a patient to include to include an oral cancer screening, and put that in their note so that it's known for a later date. If you haven't had this before, next time you see your dentist, mention, hey, I'd like an oral cancer screening, and I'm sure that could be done. And finally, here are my references. Thank you so much for listening.